I'm Jerald DeLagarza, pediatrician at Rutherford Children's Care. So we define fever based on two different age groups. The first age group is 0 to 2 months, which our temperature is considered to be a fever if it's over 100.4. The other one is from greater than 2 months to 18 if the temperature is greater than 101. In the children who are less than 2 months, 100.4 is considered an emergency and they need to be seen pretty quickly. Whereas children who are above 2 months have a temperature greater than 101 usually don't need to be seen if we have a good reason for their illness or if we don't feel that other symptoms are causing them to be seen emergently. The first answer is always be calm. Fever is okay. Fever is protective. Fever is helping children fight viruses and bacteria, not the other way around. So the big thing is be calm. If they have a temperature, again, they're greater than that 2-month period, use Tylenol or ibuprofen to help control the fever. But for the most part, just supporting your child and being there with them is going to be the most important thing for them. So a couple things I definitely avoid doing. Number one is using alcohol baths, for example, or using very cold baths for children who have fever. These things do not help children and actually make them feel much, much worse. The other thing, I don't believe in actually rotating Tylenol and ibuprofen consistently for children. I like to use medicine if they need it. And again, if they need it, it's for a temperature greater than 101 in those kiddos above 2 months of age. Again, children less than 2 months who have a temperature greater than 100.4, I would not treat that fever again, but take them immediately to be seen at their child's office or in the emergency room. There's not really a bigger effect. In fact, we know now through our immunization program that we've decreased the amount of bacterial infections in this age group. So we've gone from essentially 5% down to 1% risk. So there's really not a big problem with those kiddos. The big thing is they probably have viruses that are causing them to have fever. So the best thing to do for those kids is to make sure that their fever doesn't last more than 3 days and they don't have, again, concerning symptoms like problems breathing or painful urination or vomiting. If they're doing fine than that, keep them at home, a lot of supportive care, and again, use a medication for their temperature. So in the evening, that's the biggest question we have for children who have a temperature. If my child has a fever greater than 101, what do I do right now? And do I need to be seen in the emergency room? My answer is almost always going to be no, that they can be seen in the office the next day. The only time that breaks down is if they have persistent vomiting. Again, if they have difficulty breathing or shortness of breath. At that point, they really should be seen in the emergency room. But aside from that, treating their symptoms, wait until the morning, the best place for them to be seen is with their pediatrician. With the other, again, advent, if the children are less than 2 months and have a temperature of greater than 100.4, they need to be seen in the emergency room that night. So immunization status, the amount of sick contacts that child has had, and then the duration of the fever, how long it's been up for and how high it's been. Having those recorded are very helpful to guide our workup with these children.